I'm a pediatrician and a father, and I won't be following the ACIP's recent recommendations. Let me tell you why. This morning, the ACIP voted to change some of the recommendations regarding hepatitis B protection for infants. First, they voted to drop the universal recommendation for hepatitis B for all infants, a recommendation that has been around for 30 years and has caused a 99% decrease in hepatitis B infections among children and is also supported by the World Health Organization, or WHO. They do still recommend getting that vaccine at the 2-month visit. They also voted to recommend that parents and providers talk about checking antibody levels following hepatitis B vaccination, and to use those results as a determining factor if children should get additional hepatitis B doses. That makes no sense. First of all, we don't do titer levels following vaccination for any vaccines. Neither does anybody else around the world. That's because drawing titers, first and foremost, is not an accurate representation of acute immunity, meaning immunity right now, or long-term immunity. Meaning if one dose gets you above a certain titer level that you're protected, that doesn't mean that one dose is going to provide sufficient protection for your whole life, which is what our job to do as parents and pediatricians is to protect children for their whole life, not just their childhood. Second, there's no good science saying what that established protective level should be. In fact, the level they suggested of 10 is actually considered the threshold for low responders to hepatitis B vaccination, where in other studies, levels above 100 were what considered good responders to hepatitis B vaccination. And finally, and probably the most important consideration with this recommendation, what parent is going to want to take their kid in for a blood draw following every vaccination? Blood draws are not only traumatic to children and families when they have to get them, but they're also costly and time consuming. And this could set up a precedent that after every vaccine you get, you need to draw levels to determine need for future vaccines, which could mean tens to hundreds of blood draws that are not necessary and don't really tell you the true story about immune status following that vaccine. More suffering for children, more time commitment for medical care, and no true benefit. This recommendation is not good for families. It's not based in science. These are the types of changes that pediatricians and scientists were warning people about when the whole ACIP was fired and replaced by people who didn't have the credentials to be there. That's why for me and my patients, I'll continue to recommend the good science. Protect babies and do no harm.